Much. And I'm going to talk over the next 20 minutes or so about different ways of thinking about sleep and different ways of looking at sleep, and try to challenge you and get you sort of out of your comfort zone. Those of you who are at the workshop this morning about polysomnography may have even been learning about some of the EEG characteristics of sleep stages for the first time. Well, now we're going to leave that behind and move on to some other ways of thinking about things. When we start to think about looking outside the box or different ways of thinking about sleep, we really got to step back and think, well, what is sleep? Is it how it feels to the sleeper? Is it what it looks like to the bed partner? Is it the functional outcome and whether it restores somebody? Or do we boil it down to a neurophysiological categorisation? And in fact, it's all of these things. And each of them can be measured in different ways, and not all of them agree. And how these measurements disagree and how these experiences and observations disagree can be really helpful in getting different perspectives at looking at sleep. You'll all have the examples of people with insomnia who swear they don't sleep at all. That's the experience, but their partner says, no, I see you sleeping, I talk to you and you don't respond, and functionally they feel well during the day. So that these ways of looking at sleep don't necessarily align. How do we classify sleep? Well, traditionally we classify sleep using the Rechtschaffen and Kale's criteria, which divides sleep arbitrarily up into non-REM 1, 2, 3 and 4 and REM. Now I've got to tell you, this is a 1968 consensus document. So it's a 51-year-old document made by a collection of guys that were sitting around the table and decided that was the 5 different boxes they were going to put sleep and wake into. And how much has it changed in 51 years? Well, instead of 3 and 4, we now have 3. That's it. Hasn't changed in 51 years. Yet technology's moved on enormously, and our understanding of what the brain does during sleep has moved on enormously. And so simplifying sleep analysis into just these arbitrary categories that were arbitrarily defined results in a lot of rich data. And that's what I'll try and talk about. Because this is what we were driving. You know, I'm not American, so I wasn't driving this in 1968. But none of us drive cars like this anymore. So why should we be comfortable delivering healthcare to people in a model like this? You know, we need to move on. We need to think about different ways of looking at things. And this is how we used to do sleep studies. So 30 seconds per page, 960 pages. At the end of the week, when I went to Boston in 1998, this is the way they were doing sleep studies there. At the end of the week, there would be a pellet and a forklift would come and take away all the sleep studies and take it down to long-term archiving and off-site storage. But what we've been able to do is digitise data. But we've got to recognise that with digitising data, essentially we apply the same categorisation that we did to the paper charts, and all we use the computer to do is to add it up into a table rather than having the technicians manually tabulate it like they used to. We're not using a lot of the ability of those digital signals in a big data sense, and thank you Himanshu for introducing those concepts, of seeing the richness that we can get from all of that digital data. And why is there a problem with the Rechtschaffen and Kale's criteria? Because they don't correlate well with outcomes. There's not good correlation between traditional sleep staging and neurocognitive outcomes. If we look for changes in sleep staging with some of the intervention studies, for example, that we do in insomnia, we really don't see much change because they're insensitive measures. There's not a good correlation with cardiovascular outcomes, with snoring and sleep-disordered breathing, or patient-reported outcomes in insomnia. So what are the alternatives? So there's a few. So I've got to tell you, I love a hypnogram. I think looking at how sleep evolves across a night, think of it as the story of sleep. You know, patients ask me, how do you tell if I've had good quality sleep? I don't know the answer to that. I'd challenge any of you to tell me what's the answer of what is good quality sleep. But when I'm looking through a study and going epoch by epoch, I want to know what's coming next based on what's gone before. It's not jarring, it just flows and it has a natural progression and you see it evolve. Whereas someone who's got a sleep disorder, you get these just in and out of different sleep stages. It just doesn't have that rhythm and that progression to it. We can look at concepts of sleep stability, which I'll talk a bit more about, and we can look at sleep patterns over time. Changes in technology are allowing us to look at sleep longitudinally. Millen showed a similar slide to this, so think of this as, I like to use the term sleep macro architecture to define the distribution of sleep stages, the cyclical nature of sleep, so that we sleep in cycles with deeper sleep, lighter sleep, and progressively lighter sleep as the night goes by. But one of the ways of thinking about sleep is looking within a cycle. So think of this as getting at the microstructure. One system for this is the cyclic alternating pattern system, originally used in France in the 1950s, but resurrected a bit by some Italians in the 1990s and 2000s. So think of this as your delta power. So at the top is delta power. There we go. So at the top is delta power across a night with your traditional sleep cycles. But then at the bottom is the oscillation between sleep states within a sleep cycle. So even within a cycle, you get oscillations between lighter sleep and deeper sleep within a cycle. So if you think of sleep as a scales, so there's an analogy I sort of talk to patients a bit about, because we tend to think of it as a bit more like an electrical switch, this binary thing, you're either on or off. But think of it more as a continuum, with full wake at one end, full sleep at the other end. So a scales or a seesaw is another way of thinking of it, that can be somewhat more weighted to one side or somewhat more weighted to the other side. Because patients think about it as being extraordinarily stable like this. You're either stably asleep or you're stably awake. But in fact, a lot of the time you're in the middle, and it takes only minor variations in state to slip into a little bit more towards sleep or a little bit more towards wake, and having activity in brain regions that is still wakefulness during sleep, where other parts of the brain are asleep but some parts are awake, helps explain the experience for patients of having awareness of things even during sleep, ruminations about daytime activities, vivid dreams, awareness of other family members coming home but still being asleep. And that's one of the fundamentals of cyclic alternating pattern, this concept that within sleep we're in this oscillatory state between lighter sleep and deeper sleep with awareness and non-awareness. What does it look like? So this is a 1 minute epoch. So when you're looking at cyclic alternating pattern in non-REM, you're looking at 1 minute epochs, and you're looking for 2 A phases per 1 minute. So an A phase is some faster electrical activity, a K complex or larger amplitude waves, so that's an A phase. And then an A phase is followed by a B phase, which is relative suppression of EEG amplitude. So that's your sort of B phase. Then you've got A phase, B phase, A phase, B phase, A phase, B phase. So this is an example of unstable non-REM sleep. Because if we look at the EEG in insomnia, so a traditional hypnogram at the bottom of the slide there, it actually looks reasonably normal, some N1, N2, N3, back through N2 REM, another cycle. But it's so out of keeping with the report. This particular patient had a high insomnia severity index, low Epworth Sleepiness Scale score, subjective long sleep onset latency, subjectively awake for hours during the night. Whereas if you think about it in this terms and think about it as that scales that's a little bit more weighted towards sleep, a little bit more weighted towards wake, a little bit more weighted towards sleep, a little bit more weighted towards wake, and you see that rhythm of A phase, B phase, A phase, B phase across the EEG, it fits a lot better with the patient experience. Once you start to get your eye in for that, you can see it in the hypnogram. So in this example, the first couple of sleep cycles a bit denser, fewer arousals, less periods of N1 or wake. But as the night goes by and there's less delta power, there's more N1, there's more oscillation between 2 and 1, which really is a representation of this unstable non-REM. Okay. Now that's how you look at it in the EEG. And that's something everyone can do because we record this data already. If we then want to take it to the next level, we can run some maths on our digitised data. So this is some work I was involved in when I was in Boston with Robert Thomas, and we collaborated with MIT. to run some maths on rhythms occurring within a lot of the data that we record. We're particularly looking at the coherence between respiratory rate and heart rate as a measure of sleep stability. But the other thing this did was allow you to look at other rhythms during sleep. Now, this particular patient had periodic limb movements, so you can see on the left-hand side we've got a histogram chart of the periodicity of their involuntary movements during sleep, and they're not random, they reach a peak at about 20 seconds. And then if you look at the right-hand side, that correlates with an increase in spectral power at 50 millihertz, which is a 20-second frequency. And so using this mathematical technique to look at oscillatory phenomenon within sleep, we could tease out that power spectrum band at about 50 millihertz, indicating periodic limb movements, as well as look at the sleep-disordered breathing. Okay, although we've talked about tech with big data, we can actually go low-tech. So sleep diaries are incredibly helpful to get a longitudinal idea about sleep. I really like these visual sleep diaries. This is 2 weeks of a visual sleep diary of someone who's having trouble with sleep. In fact, it's not really long enough to pick a pattern. It turns out this particular person had a free running circadian rhythm, but 2 weeks isn't quite long enough to see that pattern emerge. This is another person who did a sleep diary. Once you've seen a few of these, you can pick them. This is someone who was on ice, so methamphetamine or a lot of stimulants, because essentially someone on high amounts of stimulants, cocaine or methamphetamine, has wake, sleep, and has no circadian aspects to their sleep-wake pattern. As sleep diary data extends and you measure data for longer, you can see more signals. So the left-hand column is a patient of mine who had about 3 months of sleep diary data that he plotted, and he was quite mathematically minded, so he plotted moving averages of the time of sleep onset and the midpoint of his sleep time, which Milind spoke about in that paper from Till Ronenberg. And he really showed that this guy's got a free running circadian rhythm. So although it looks a bit chaotic, when he plots that midpoint of his sleep in the dark brown line, it's actually nicely drifting later and later. The sleep diary on the far panel is another patient of mine, and this is about 12 months of sleep diary data. He was in a stable phase delay and had quite severe depression and not working. And then when his depression got worse, in about the middle there, he was free running, and then we started to manage his circadian rhythm and got him back to a better entrained rhythm. And once he was there, he actually got back to work. He hadn't been working for nearly a decade. But sleep diaries tell you other things as well. So this is another sleep diary from a patient of mine. It doesn't tell me anything about the timing of sleep, but it certainly tells me something about personality traits in terms of completing that diary. And if you can read the fine print, he also wrote how much whiskey he's taken on every single night, and it was quite a lot. We saw some actigraphy data from Milind. So when we think about other ways of going beyond sleep stage analysis and getting insights into sleep, actigraphy can be really helpful. The problem is it's hard to access. Professional actigraphy is really a good research tool if you're used to it, but if you're not used to it, there's so many tweaks you can make to the algorithm that it's hard to do well. And that's where consumer devices come in. This is actually, just as an aside, so a researcher who put actigraphy and plotted feeding and behaviour patterns of his newborn for the first 100 days of life. As you do, you experiment on your kids, that's why we have kids, right? And really nicely showed this chaotic sleep pattern, much like the cocaine, methamphetamine user, that by about day 50 of life is starting to become somewhat entrained, and by day 100 of life there's emergence of a circadian mediated entrainment of both sleep-wake behaviour and the feeding fasting patterns. So wearables are being used. So consumers are wearing wearables, be they Fitbit devices, be they smartwatches. You know, the Fitbits were more 2015, 2016. Now it's more smartwatches like the Fitbit Versa that's got heart rate and movement. Problem is there's very few validated studies to show their accuracy. But the potential advantages is lots of trends over time. You get an idea about sleep within and across populations when you pull data, and it's empowering people to collect their own health data. This is, for me, data used for good. So this is some data we collected a couple of years ago using the Jawbone device, and their particular software used to allow you to plot sleep by week. So this is a bar chart, histogram of how much sleep this person had each week over a long period, so about a 3-month period, and it's relatively stable. Because if you plot the sleep of someone with insomnia on a day-to-day basis, it's very variable, and I'm sure you've all had people show you their Fitbit data and go, look at it, it's all over the place. But if you plot it week by week, it actually shows quite stable homeostatic sleep-wake regulation. One of the things you can do when you start thinking about other ways of measuring sleep is look at sleep length in a population. So this is the same company, Jawbone, published the measured sleep length of everyone wearing a Jawbone device in Australia, and showed that women were getting about 7 hours and 20 minutes sleep at night, and men were getting about 7 hours sleep at night. Okay, but are they accurate? So that's now come to that question. And the answer is they're not that great, but they're okay. And it really depends on what you're looking for. All of the algorithms are somewhat different. They're all black box algorithms. By the time we assess them, there's a new algorithm. But the main thing is that if you take it as it'll be sort of plus or minus 1 hour of total sleep time, then you can work with that as a figure. But if you look at someone's data and you can see trends over time, I find that the most helpful thing. We've done a study where we compared 3 different devices to full polysomnography, and we've got your hypnogram at the top. The next one down is the S+, which was a ResMed device that uses ultrasound to look at respiratory events and heart rate, and then as a surrogate for sleep staging. The next one down is a Jawbone device, an activity tracker, and the next one down is the Bedit, which has now been bought by Apple, and it's a device that you lie on your mattress that measures via ballistocardiography, heart rate, respiratory rate, and sleep. Thank you, Millen, for showing this slide. I really like this as well. So there's a number of papers looking at how we can access big data, so to try to tie back to this theme of big data, to get an idea about sleep-wake behaviour beyond what we get from sleep staging. I had a different take-home from you, Milland, on this graph. I liked the right-hand chart, which really showed that how long, at least in these 20 top countries, how long you slept for was very dependent on your bedtime and somewhat independent of what's on the left-hand panel of your waking up time. So it didn't really matter what time you woke up, it was what time you went to bed that determined how short or how sleep restricted you may be. Another example of using big data is, this is a study of about 17,000 young adults, adolescents and young adults, who were wearing polar heart rate devices, and essentially just pooled all the data to look at sleep duration, sleep onset, sleep offset times, weekdays, weekends, plotted by age of life. And we can really get great insights into sleep in a population with this type of data, seeing the shortening of sleep, that crunch time around the sort of ages of 18, 19, 20, and then the differences in sleep onset between weekdays and weekends, for example. I like Twitter. I'm not sure whether Twitter's that popular in India, but certainly amongst scientists, Twitter's quite popular. And there's a number of apps that look at people's tweeting habits and correlating that with their sleep length. And there's a really cool site if you want to look at sleeptiming.org. You put in someone's Twitter handle and it tells you their predicted sleep time based on the timing of their last 1,000 tweets. So it's good for stalking people. But this particular study looked at the tweet trough. So when people were least likely to be tweeting, and that correlated in the bottom graph with approximate sleep duration, plotted across a year. They could then put things like holidays, spring break, summer break, seasons, to get a feel for how all these social factors interacted with Twitter behaviour as a measure of sleep length in a large population. So to finish up, when we're looking beyond sleep stages, we can look at the data we've already got within the PSG and look at sleep stability, but there's many other tools we've got to look at sleep rhythms, the cycles of sleep and other features of sleep, as well as being able to incorporate diaries, wearables and big data. Thank you.